Hi, so let's continue non-epithelial tumors of oral cavity, part 3, hemangiomas and vascular malformations. Okay, um, classification of vasoformative tumors. Vasoformative tumors. So these are divided into two parts: hemangiomas and vascular malformations. Okay, hemangiomas are of three types: capillary hemangioma, cavernous hemangioma, and mixed hemangioma. And vascular malformations are of four types: venous malformation, capillary, arteriovenous malformation, and intramuscular malformations. We have seen in the previous video that hemangiomas are not present at birth and will be after 1 month of birth, and malformations, vascular malformations are usually present at birth. Then clinical features: hemangiomas seen in oral cavity, paraoral lesion present as soft fluctuant swelling compressible. Hemangioma क्या है कि seen in oral cavity, paraoral lesion, hemangioma present as soft fluctuant swelling compressible. It will be compressibility test of Blanch test. Okay, upon release of pressure, the lesion fills. Upon release of pressure, the lesion fills up against. Okay, Blanch test. You know all. Most common site is seen on lips, gingiva. Lips are more red, so there will be good, अच्छे तरीके से दिखेगा Blanch test. So इसलिए more common site is lips. Then gingiva, then tongue, then floor of mucosa. Intraosseous hemangioma is most common in mandible than maxilla. Very more common intraosseous in mandible. Then intramuscular hemangioma is most common in masseter. Then vascular malformations present at birth and grow with the growth of child, not show involution. Treatment: surgical sclerosing agent used. Okay, vascular malformations present at birth and grow with the growth of child, not show involution. Treatment: surgical sclerosing used. The histopathology is capillary hemangioma, cavernous hemangioma. Blood capillaries engorged with the RBCs and lined by endothelial cells. Blood capillaries engorged with the RBCs and lined by endothelial cells. Capillary hemangioma. ओके, हेमेंजियोमा डन हो गया। अब यहाँ से वैस्कुलर मालफॉर्मेशन था तो वो प्रेजेंटेड बर्थ ग्रोथ हमने पहले देख लिया था। नॉट स्लो इन्वोल्यूशन। ट्रीटमेंट सर्जिकल स्क्लेरोसिंग एजेंट या फिर इसमें यूज़ कर सकते हैं। कैपिलरी हेमेंजियोमा इज लाइक दिस एंड कैवर्नस हेमेंजियोमा इज लाइक दिस। कैवर्नस मीन्स extravasation of blood vessels. Yes, this is now important and interesting part. Osler-Weber-Renville syndrome. It's also called as hereditary hemorrhagic telangiectasia. It's an autosomal dominant disorder. Mutation of 12q tumor growth factor beta. Okay, mutation of endoglen gene 9q43, triad of epistaxis, nosebleed, family history positive, and telangiectasia, spidery web telangiectasia. Then Serge-Weber syndrome. Telangiectasia or spidery shaped telangiectasia are more common feature of liver toxicity or liver disease. Okay, then Serge-Weber syndrome, also called as encephalo-trigeminal hemangiomatosis. Okay, facial capillary malformation. Portoise nevi, like it's unilateral, and portoise nevi, like color facial malformations are seen. Supplied by trigeminal nerve. Intracranial vascular malformation associated with calcification. Tracranial vascular malformations associated with calcifications, which leads to convolution seizures. Mental retardation, eye lesions associated with glaucoma. Okay, parallel calcifications, tram-like calcifications on radiograph is seen. Tram-like defect or effect is different, which is seen in CSF synuria. Midface fracture on pillow to paraline seen. And in when skin plus CNS lesions are involved, the term is called as phacomatosis. Phacomatosis. Intraoral vascular malformations. It's usually unilateral. First, most common site is face, and then gingiva, then buccal mucosa, lip, and tongue. Increased tendency to bleed post extraction. So, most of the diameter is discovered at the time of, you know, extraction if there's no potoineva are present. Portpoint stains. If at the time of post extraction, after extraction is done, increased bleeding, BTCT is normal, then we can judge that it's a Sturge-Weber syndrome. Bryogenic granuloma. It's a misnomer because pus may be or may not be present. Granuloma biogenicum. Vascular lesion, not neoplasm, not malformation, tumor like growth, but not tumor. Reactive lesion it is. Okay, it's a vascular lesion, tumor like growth. It's present but not a tumor. Increase host response to minor trauma. Right. Okay, छोटे से भी अगर चोट लगी है तो मतलब उसका host response बढ़ जाएगा, which can lead to invasion of tissue via non-specific microorganisms. Increase proliferation of vascular tissue, increase capillaries, and increase inflammatory cells. Increase proliferation of vascular tissue. Capillaries बढ़ जाएंगे, inflammatory cells बनाएंगे, granulation tissue will be pregnancy tumor because it will occur on the seen last of third month or second trimester. Increase in progesterone level causes increased vascular response. Most common source of trauma is plaque due to poor oral hygiene. Viscositis, gingiva 75%, buccal mucosa, labial, tongue, and rectal side. Granulation tissue proliferation of capillaries lined by endothelial cells, increase inflammatory cells. Granulation tissue is proliferation of capillaries lined by endothelial cells, increase inflammatory cells. Okay, seen in lobules, also called as lobulated capillary hemangioma. Lined by endothelial cells, increase inflammatory cells. Seen in lobules, also called as known as lobulated capillary hemangioma. Treatment is simple excision of prognosis is good if good oral hygiene. Then lymphangioma, benign proliferation of lymphatic vessels. Benign proliferation of lymphatic vessels. Majority head and neck region, oral cavity, tongue is most common site. Large cystic swellings are seen in neck region. Cystic hygroma type of lymphangioma. Present on tongue as multiple small size grayish pinkish nodules. So diffuse frog egg appearance on tongue or tapioca pudding. If diffuse lesion, then macroglossia is seen. Like lesion is seen. Lymph fluid. Histological features, there are three types of lymphangiomas: simplex or capillary type, cavernous spaces, increased size type. These are the cavernous type, simplex or capillary type, simple capillaries, and then cystic, lined by fibrous connective tissue, vascular connected, but rarely seen in oral cavity, but common in neck region. Cystic hygroma. Okay, this stage close to surface. Then myxoma. Myxoma, it's a benign lesion, soft tissue neoplasm characterized by myxomatous tissue. Increased ground substance is present in myxoma. Cells will be loosely arranged because increased ground substance. More amount of hyaluronic acid is present in myxoma. Mesenchymal cells are stellate shaped and reticular fibers are present here. Okay, locally infiltration of hyaluronic acid, not it will not metastasize. It's locally infiltrating, not metastasized. Seen rare, seen in myxomatous changes are common. Seen in pleomorphic myxomatous changes are commonly seen in pleomorphic adenoma, long-standing tumor, ameloblastoma, or mucoepidermoid carcinoma. Then chondroma central. Chondroma is a central lesion, means intraosseous lesion. Neoplasm of mature cartilage. Neoplasm of mature cartilage. It's a benign lesion, rarely seen in oral cavity. Have high potential to transform into chondrosarcoma. This one lines. Chondroma has the high potential to transform into chondrosarcoma. Insights in oral cavity, condyle coronoid process, and symphysis. Okay, these three sites, condyle coronoid process and symphysis. Then histopathology is cartilage tissue converts to clear cells. Osteoma, characterized by formation of bone tissues, very commonly seen in jawbone and paranasal sinuses. First sinus to develop is maxillary sinus. Okay, middle concaves. Inferior concha is अपने आप में एक बोन है. Middle concha is a part of ethmoid bone, and superior concha is also a part of ethmoid bone. Very commonly seen in jawbone and paranasal sinuses. A syndrome associated with multiple osteoma is where characterized by formation of bone tissue, very commonly seen in jawbone and paranasal sinuses. Syndrome associated with multiple osteomas. Gardner syndrome not associated with pain. Osteoma is not associated with pain. Garden is happy, not pain is not present there. But is a slow growing mass. Osteoid osteoma is the differential diagnosis, because here in osteoid osteoma pain is present. Okay, histopathology of osteoma is comprised of either compact or cancellous bone. Very difficult to diagnose osteoma from normal bone. It's very difficult to diagnose osteoma. Then osteoid osteoma associated with sharp acute pain exons was seen passing through osteoid osteoma. Osteoid osteoma contains increased amount of prostaglandin E2, aspirin, salicylate, NSAIDs. That's why play a major role in the pain management of osteoid osteoma. Aspirin, salicylates, and NSAIDs. Okay, usually smaller in size, osteoid osteoma, but when grow large, called osteoblastoma. Differential diagnosis from osteoid osteoma from osteoid difference between osteoblastoma and osteoid osteoma is it's small, छोटे में, and it's big, large, बड़े में. Okay, it's a radiolucent lesion in starting, and then it will convert into a radiopaque lesion. This is radiolucent lesion surrounded by sclerotic margin. Increased mass of osteoid tissue. Increased mass osteoblastoma has increased mass of osteoid tissue, blood vessels, and multinucleated giant cells. Osteoid tissue is present, but blood vessels and multinucleated giant cells are not present, because it is small and it does not have the space to, you know, to keep the blood vessels and multinucleated giant cells. Generalized pain is present, does not respond to aspirin. Here sharp pain. Here generalized pain does not respond to aspirin. Here it will respond to aspirin and sharp pain might present. Okay, then torus bony exostosis seen in relation to mid-palatine raphe, torus palatinus, seen premolar molar called in premolar and molar called torus mandibularis in mandible. Okay, then this bony exostosis. If present in maxilla mid-palatine raphe, then palatinus, torus palatinus. Then etiology is genetic and environment. In environment, increased masticatory stress. Histopathological features are histological compact bone outside and cancellous bone inside. Treatment is surgical excision.